Hi there, I'm Dr. Benfield, I'm a GP, and this video looks at the main types of inhalers used for asthma. Now firstly, there are two types of devices. We have the aerosol type and the dry powder type. Now this aerosol type contains the medication in a capsule. You press it down, or be some other mechanism that then fires out the medication as a gas, and you have to coordinate the push down with the breath in, and that gets the inhaler medication into your lungs. Main problem with that type of inhaler is that many people don't coordinate that push and suck well enough, so not enough inhaler gets into the lungs. You can combat that by having a spacer device, and that's where you attach the inhaler to the spacer and you put your mouth on the side, you fire the inhaler into the spacer, and then you do 2 or 3 slow, good breaths in and out through the spacer. It gets a lot more in your lungs. The other type of inhaler are the dry powder inhalers, such as these two. Now, these contain capsules, and there'll be some mechanism like twisting the capsule or opening the lid. And what that does, it puts the next capsule into the right place and pierces it so that when you suck, all the inhaler goes into your lungs. Very easy to use, you pretty much can't get it wrong. You twist it, you suck it, it goes into your lungs. It's a better inhaler to use than the aerosol ones, but some people don't quite like the taste because it's a bit more gritty. It's got a dry powder rather than the gas of the other one. In terms of medications, I'm going to start with the one that you will know the most, which is the blue salbutamol inhaler. Now, the commonest brand used to be Ventolin. Now the commonest brand is Salamol, but they all contain salbutamol. Salbutamol is very similar to adrenaline. Now, so if you've ever had to use lots of puffs in one go, probably notice heart racing, sweating, bit of a tremor maybe. What they do, it opens up your breathing tubes, your airways, very quickly, and that lasts for 4 hours, but it doesn't reduce how bad your asthma is overall, and an over-reliance on the blue inhaler significantly increases the person's risk of developing severe asthma attacks. Second type of inhaler is the brown inhaler, and I haven't got the really normal one, but this is a type of brown inhaler, and it contains the medication beclomethasone. The commonest brand currently is Clenil, and using this does reduce the severity of a person's asthma, reduces their risk of ending up in hospital. However, it takes about 2 weeks to start working, and many people don't use it enough, possibly because they don't notice a benefit at the time of using it. And with the old regimes, people would increase their blue inhaler use when their asthma got worse, but they wouldn't increase the brown inhaler use, and that puts people at risk of severe asthma attacks. Now, the third type of inhaler is the combination inhalers, such as Symbicort and Foster. Now, these contain both a version of the brown steroid inhaler and a version of the blue inhaler in one together. So 2 and 1, so the Symbicort contains both together. Symbicort and Foster contain a version of the blue inhaler that works just as quick as the blue inhaler, but lasts for about 12 hours. And it contains the steroid as well. Now, there are several other types of combination inhalers, but most of those don't contain the version of the blue inhaler, which works really quickly. And the aim for people now with asthma is to have just one single inhaler. These combination inhalers, instead of having a separate brown and a separate blue. Okay, thank you for watching. Next video, we'll talk about what's happening in your lungs as your asthma worsens and how the medications actually help. Thank you.